Welcome back to Care of the Child with Cancer. This section will address bone tumors. The most common bone tumors that occur in children are the osteosarcoma and Ewing's sarcoma. So the most common is osteo. It occurs in teens at the time that they're going through rapid bone growth. Girls tend to do this before boys because, they go through that growth spurt a little bit quicker. It's very rare that one of these tumors is going to occur prior to the onset of puberty. There tends to be a family pattern, and there might be a past history of radiation. So they've had some other type of tumor, or they've just had the exposure and they didn't know that they had it. And this tumor originates in rapid growing bone, and that's why it gets started during the adolescent period when kids are really growing quickly. And it's affecting the femur, the tibia, as well as the humerus. Now, Ewing's sarcoma comes anytime between age 10 and 20, and it's primarily seen in the Caucasian population. It's rare that this type of tumor metastasizes at the time that we're diagnosing. It doesn't mean it can't metastasize, but at the time the child presents, it isn't a metastatic process. This also affects the femur, but it can affect the vertebrae, the ribs, and the pelvis. And this one is tough because it might present as a soft tissue mass, and it's the swelling of the tissue around the bone that's affected. This is a picture of what an osteosarcoma would look like. The osteosarcoma is the one that the kid's complaining of bone pain, and the adults are busy saying, you're just going through adolescence and you're going through the bone spurt. Just call those growing pains. The pain starts at the area that's affected, and it gets progressively worse, and it's a slow growing tumor. And it might be an intermittent pain, and it's not necessarily associated with activity. Eventually, there is a palpable mass. The kid starts limping. They have decreased range of motion because of the pain. And a late sign is that all of a sudden they have a spontaneous fracture. And we call that a pathologic fracture because the bone has been weakened because of a tumor. Ewing's sarcoma, because it presents with very vague symptoms, pain and fever and soft tissue swelling, it's diagnosed by exclusion, and then they'll finally see it on a CT scan. The picture on the left is a tumor that's affecting the bone of the knee, and you can see the swelling around it. And here's a picture of a Ewing's sarcoma, and it is on the lower part of the ribs on the left side. I've seen a couple kids that had that exact tumor, and it was quite painful. For the osteosarcoma, they are going to get chemotherapy prior to surgery as well as after surgery. They're trying to save these kids' limbs as much as possible. So they do the chemo, then they remove the tumor, and then they do some type of a bone graft. And I have on the next slide where they've done an actual limb salvage operation. Some cases will require amputation of the extremity. Radiation is going to be used if the chemo didn't work and for palliative care. Ewing's sarcoma also has chemotherapy prior to surgery just to debulk the tumor itself, make it smaller, so the resection is going to be less invasive. And then it is followed by radiation. So you can see there's a little difference between these two. Osteosarcoma is going to be chemo, surgery, chemo, and Ewing's is going to be chemo, surgery, then radiation. So put this on pause so that you can actually read and take a look at how they've salvaged this limb, that they were able to put a bone graft in place. They spared all of the growth plates, and so this child will be able to grow normally, even though they had an osteosarcoma. Your post-op care is going to be the same as it would be for any surgical patient, but if they had an amputation, remember, we're going to be doing stump care. Now we're going to be addressing the phantom limb pain that patients have after they've had an amputation. Body image disturbance is going to be huge. and they have to get fitted for prosthetics and learn how to walk around using that prosthetic. So our rehab partners are going to be involved. Our psychosocial care, because of the loss of body image, there's going to be a grief response, and there's going to be some anger and why me type things. They may become depressed. So we want to get these kids connected with other kids who've gone through similar problem and get them involved in support groups. And you can see on this picture a little girl who had an osteosarcoma, and she's lucky that she didn't lose any limbs, and after all of the treatment, she's just one of the girls. And this ends the lecture on bone cancers.